topic is non-Hodgkin's lymphoma. Hello dear students, we'll discuss a different clinical case today. What this condition is, look at that. There is a swelling here, in the neck swelling is here, axilla swelling is there both sides, see that? And groin swelling is there. Because of the swelling, lymphedema has occurred, ram's horn penis has occurred, saxophone penis otherwise called as, and scrotal edema has occurred, lymph node here, lymph node here. Look at that, hepatomegaly may be there. Maybe there is a lymph node mass in the para-aortic lymph node mass is there. Axillary nodes are there, and the neck nodes are there here, and preauricular nodes are near the parotid. Lymph nodes are there. All over nodes are there. Asymmetrical involvement, and see that node here, same patient. See that here node, here node, here node. See that? See the nodes here, posterior triangle in a close review actually. So many nodes are there all over, different groups, asymmetrical involvement, neck, axilla, para-aortic, groin. Then you have to look for epitrochlear lymph node. Here, Siemens node it is. Then you have to look for the outer wall ring, preauricular, postauricular, parotid here, cervical, occipital nodes. Then inner wall ring, adenoid, tubal tonsil, palatine tonsil, and lingual tonsil. It may get enlarged. It's a feature of non-Hodgkin's lymphoma. HL is the non-Hodgkin lymphoma is the commonest type of lymphoma. But in children, HL is common, remember. It is the commonest type. NHL is the commonest type. Don't get confused. And features are, it's usually adult and elderly, and the commonest type of lymphoma overall. More aggressive, asymmetrical, peripheral lymph nodes are involved, epitrochlear, and inner wall ring is involved. It's very important. So all these lymph nodes has to be examined. Vertebra may be get involved with paraplegia. Diffuse large B-cell lymphoma is the commonest type. MCQ question, this one. Rappaport working conditions are different classifications. Main treatment is chemotherapy. Radiotherapy you can give once there is a spine is involved or brain is involved and so on. Main treatment is chemotherapy. CHOP, CHOP, chlorambucil and other drugs. CHOP and R-CHOP regime, MBBS regime can be used. CHOP, CHOP regime. And remember, real classification like these different classification mainly for the lymphoma. It is generally classification for lymphoma. Revised European American classification for lymphoma, B cell, T cell, Hodgkin lymphoma, precursor lymphoma, immunodeficiency lymphoma. For NHL, RAPA classification and Rappaport classification, working classification. And differences between HL and NHL you have to know. HL bimodal, symmetrical axial, it is asymmetrical, non-contiguous. Neck nodes are commonly in HL, not common. Splenomegaly common in HL, not common. Peripheral nodes not common here, very common, epitrochlear, inner wall ring. And treatment mainly RT here and chemotherapy here. CHOP regime, R-CHOP regime. Mainly chemotherapy here, remember. Here mainly RT, differences, proves better. So R-CHOP, CHOP here, MBBS is the main chemotherapy. Here, this is the main chemotherapy agent. So you should know what are the main therapeutic agents. So these are the differences you have to remember. NHL is again very common, remember. You should know the differences between the HL and NHL I can put in the table. Lymphoma which is associated with the Helicobacter pylori is Hodgkin lymphoma, non-Hodgkin lymphoma, Malt lymphoma, Burkitt's lymphoma. Students, put the right answer, I will get back to you. Lethal midline granuloma is tuberculosis of the nasal septum, syphilis of the nasal septum, vaginal granulomatous of the nose, extranodal NKT cell lymphoma of nasal septum. Find out the right answer, put it in the box. So students, go through my SRB's clinical methods in surgery, which has got a video lectures of each topic. So many topics are covered, every topic as far as CBM syllabus is covered, how to examine the patient. Swelling, ulcer, arterial disease, venous disease, thyroid, breast lump, mass abdomen, briefly orthopedic, every system, whatever your required thing, everything is covered. There is a video of how to examine of each topic, and principles of examination is good, and differential diagnosis in a table format is given, and briefly investigation. Suppose treatment is not a topic will be covered in a clinical method examination, remember, and many photos of the most of the conditions with the illustration. Photos will tell the clear idea about for the students how exactly condition looks like. So covers everything with the beautiful photos, and it also gives the instruments, specimens, then operative surgery briefly, everything is covered. Small images also it is covered. So it is more than sufficient for all undergraduate, postgraduates of any system to learn very basic required thing for the surgical field is clinical methods. So please go through that and purchase that and make use of it. My SRB Manual of Surgery is very popular. It covers a theoretical aspect, everything, principles, treatment in detail, beautifully technical aspect, and with the photos, illustrations, quotations, all topics with the specialty, urology, cardiothoracic, neurosurgery, and operative surgery instruments. Again, it is covered in this book also. Every quotations and used worldwide also, actually, including our country, everywhere. And please, you can make use of it. My operative surgery book, SRB's Operative Surgery Atlas, that is a 2-volume book, covers in detail operative technique of surgery, all surgery, small surgery, major surgery, everything, with total around more than 10,000 illustrations and photos. It gives very good principles and technical, step-by-step technical aspect. Very, very useful for postgraduates. Not much useful for undergraduate, but it's a postgraduate book and consultant book and learner after MS. It gives everything. You can, before going to surgery, you can always read this book and have memorize your steps and do the surgery properly. Every topic, general surgery, gastroenterology is covered in detail, step-by-step with illustrations. And my SRB's Atlas of Tissue Approximation, small book atlas, 100 pages, how to do the suturing, tissue approximation, including laparoscope suturing with the video. It is covered. So any basic learners, suturing is very, very important surgical field as a skill actually. Dissection and suturing, so the two parts of the surgical skill. So that is also covered very well with videos. You can always go through that. And my website, please subscribe, all of you. If your daily lectures are there, live sessions are there. My DigiNour lecture through JP Publishers, around 220-hour lectures. Entire thing as for CBM is covered with the examination part, with all topics of CBME, ulcer to operative surgery, instruments, specimens, examination, specialties, basic, everything is covered. You can always purchase for 1 year and have a clear idea about the surgical topics, understand very well, and helpful for your exam, NEET, MCQs. Also, it is there both in manual and my lectures. So students, I hope you have understood this lecture very well. Thank you very much.